Good afternoon and welcome everyone to the Senate Committee on Health and Human Services for the 83rd Legislative Session. Madam Secretary, please proceed to call the roll.
Senator Lang, Senator Stone, Senator Taylor, Senator Titus, Chair Donyate.
And I'm here, and please mark Senator Lang absent excused. Good afternoon, everyone, and thank you so much. Present. Mark Senator Lang present.
Right on time.
Good afternoon, and thank you so much, everyone, for joining us here today. Today, we do have 4 bill hearings on a few bills. I'm going to go over the bill order in just a second. I have a few housekeeping items for those who would like to participate. First and foremost, please note that agenda items may be taken in a different order than listed, as I'll go through that in just a second. If you wish to testify on any of the bills today, we ask for folks to please sign in at the table by the door and provide a business card to the committee secretary. If you do not wish to testify, you may still want to sign in so that there's a record of who is interested in participating on a certain bill. When testifying, please turn on your microphones on to speak and off to listen, and we have listeners here in Carson City and in Las Vegas and online, and as this will be available on the legislature's website. We ask that public comments be kept to 2 minutes today so that everyone interested in speaking can be accommodated. And last but not least, we ask for folks to turn off their electronic devices or put them on silent mode. So the order for today is we're going to do AB 343 first. And so we'll welcome our speaker first. And then we'll go to AB 185, followed by AB 521. And then last but not least, AB 484. So if folks are here for different bills, you feel free to step in and step out as we're going through this process. With that, I'll go ahead and open up the bill hearing for Assembly Bill 343, and I'll invite Speaker Yeager to begin. This bill makes provisions relating to healthcare, and you may begin.
Good afternoon, Chair Donyate, Vice Chair Taylor, and members of the Senate Health and Human Services Committee. My name is Steve Yeager. I represent Assembly District 9, which is in southwest Las Vegas, and it is an honor to present Assembly Bill 343 in its first reprint to you this afternoon. I do want to thank you for taking me out of order, as I have some other committees to be in this afternoon to present in as well. And Chair, I wanted to introduce with me at the table is Taylor Volk. He is one of our Assembly Leadership Office interns this session. After my introductory remarks, he's going to provide an overview of the bill. But before I continue with those remarks, I just wanted to tell you a little bit about Taylor. He's done an amazing job this session. He's a senior at UNLV, and while getting experience here at the state legislature, he's also working for Brookings Mountain West. His interests lie in public policy, and he has taken an interest in both health and substance abuse policy. And after graduating with his bachelor's in political science, his focus is working towards getting his JD or MPA. So he still has some education to pursue. And then, Chair, I wanted to let you know that in addition to Mr. Volk with me on Zoom, we have 2 former legislators from the state of Colorado. They worked on this legislation in Colorado. We have Stephen Fenberg, who's the former Democratic president of the Colorado Senate, and we have Patrick Neville, former Republican leader of the Colorado House. So they're going to be available to help answer questions, but I wanted to point out that they were the co-sponsors in Colorado, so it was a bipartisan effort there, and sure hope it can be here as well. So on to Assembly Bill 343. First, I want to thank you for the opportunity to present. I believe this is a critical piece of legislation that will bring much needed transparency to healthcare pricing in Nevada and ensure that patients have the information they need to make informed decisions about their medical care. Healthcare, as you all know, is one of the most significant expenses for Nevada families, yet too often patients are left in the dark about the true cost of their care until they receive a bill in the mail. That's not how a fair and functioning market should work. AB 343 seeks to change this by codifying existing federal price transparency requirements into state law, giving Nevada patients the ability to compare hospital prices just as they would for any other major purchase. In 2019, which seems like a lifetime ago, I know, 2019, President Trump issued an executive order that laid the foundation for healthcare price transparency nationwide. His administration's CMS rules required hospitals to post their pricing for shoppable services and mandated that health plans disclose negotiated rates with providers. These requirements were enforceable as of July 1, 2022. However, compliance across the country has been slow, and Nevada is no exception. According to the Patient Rights Advocate's most recent analysis, Only 35% of Nevada hospitals are currently in full compliance with the federal price transparency law. That means a majority of patients in our state still do not have access to the clear, upfront pricing information that federal law requires. I believe this is unacceptable. We cannot allow hospitals to continue operating under a system that leaves consumers guessing about what their care will cost. More recently, Chair, on Tuesday, February 25th, 2025, just a few months ago, President Trump signed a new executive order to reinforce the rules that increase enforcement. Now, it's our turn here in the state to do our job at a state level and require hospital price transparency in state law and empower Nevadans to protect their rights to be an informed consumer. AB 343 is relatively straightforward, and it's a necessary solution. The bill really does three key things. Number one, it codifies federal transparency requirements into state law. It ensures that hospitals comply with the same standards already mandated at the federal level, reinforcing accountability at the state level. It also requires hospitals to file annual reports with Nevada Department of Health and Human Services, ensuring ongoing compliance. So that was number one. Number two, it prohibits hospitals from collecting medical debt if they fail to comply. Patients should not be on the hook for medical bills when hospitals have failed to provide clear pricing information up front. If a hospital does not comply with these transparency rules, AB 343 will prevent them from pursuing medical debt collection. Additionally, patients will have the ability to bring civil action to stop debt collection in cases of noncompliance. And then number three, AB 343 empowers the state to enforce compliance. Without enforcement, transparency laws are relatively meaningless. This bill will allow the state to take civil action against hospitals that refuse to comply, ensuring that all Nevada healthcare consumers have access to the pricing information they deserve. Transparency in healthcare, as I mentioned, is not a partisan issue. It's a common sense reform that benefits every Nevadan. We've already seen strong bipartisan support for similar laws in other states. I mentioned Colorado. Ohio has successfully passed hospital price transparency law, with Ohio's legislation receiving unanimous support and being signed into law by Republican Governor Mike DeWine. Several other states, including New Mexico, Wyoming, Oklahoma, Kentucky, Oregon, Washington, Illinois, Pennsylvania, Hawaii, Michigan, Indiana, and Iowa are all currently considering this legislation in 2025. And if you parse those states out, we have some red states, some very red states there, and we have some very blue states as well. By passing Assembly Bill 343, we would be aligning Nevada with this growing bipartisan movement and ensuring that our state stands up for patients, not opaque hospital billing practices. This bill is about fairness, accountability, and empowering patients to make informed choices about their health care. Every business in America is required to disclose pricing up front. Hospitals should not be the exception. I urge your support of this measure that will allow us to join a national effort to make transparency a reality for all Nevada patients. Now, with your permission, Chair, I would turn it over to Mr. Volk to walk you through the sections of the bill in a little bit more detail, and I assure you that the presentation is not very much longer.
Hi, my name is Taylor Volk for the record. That's Taylorvolk. I just want to say thank you, Mr. Speaker, for bringing this bill forward. Hello, Chair, Vice Chair, and members of this committee. Today I'll be walking you through AB 343. So with Section 1 of the bill, or Sections 1 through 12 of the bill, it includes definitions and scope of the legislation. Sections 13 through 16 codify federal price transparency rules and establish a system of annual reporting requirements. These sections incorporate federal price transparency requirements into Nevada law. Hospitals are required to post a machine-readable file with a standard charge for all items and services, provide a consumer-friendly display of at least 300 shoppable services, and non-compliant hospitals must submit a corrective action plan and follow that plan. In Section 17, it prohibits hospitals from engaging in medical debt collection if they are non-compliant with price transparency requirements and designates such actions as a deceptive trade practice. If prices are charged to not match the posted price on a hospital's website, a patient can file a complaint with the Attorney General and DHHS to dispute the charge and ask for an investigation. While a charge is in dispute, medical debt on that charge cannot be collected. And additionally, if a hospital attempts to collect medical debt on a disputed charge, they can be fined. Now, with Sections 18 through 21, It gives the Nevada Attorney General's Office and the Department of Health and Human Services the authority to take legal action against non-compliant hospitals. It establishes penalties for hospitals that fail to meet transparency requirements, and it also ensures that Nevada can enforce compliance independently of federal agencies. Section 22 requires hospitals to provide an itemized receipt and associated information to patients. Now, I finally just want to walk through the proposed changes of this conceptual amendment that is also posted on Nellis. Item 1 deletes the requirement to have tax identification numbers be reported. Item 2 removes 95% compliance, so either a hospital is compliant or they are just not. Item 3 removes some language that isn't needed related to the posting requirements. And finally, item 4 allows hospitals to deliver itemized receipts digitally or through the online portal. So that's the walkthrough of the bill.
And Chair Steve Yeager, for the record, I was advised that I may have misspoken in part of my testimony, so I just wanted to make clear for the record that there is not a private right of action that an individual could bring. Instead, in negotiations with some of those who were in opposition to the bill in the Assembly, we made that a deceptive trade practice, so the Attorney General could take action, but you would not have the ability to bring a private right of action. So I wanted to just make that clear because I think I might have stated otherwise in my initial comments. And Chair, with your permission, we would be open for questions. And of course, we have our two experts who have done this in Colorado on Zoom, who we think will help us in answering some of those questions.
Thank you so much. Committee members, do we have any questions? Senator Titus.
Thank you, Chair, and thank you, Speaker Yeager, for bringing this bill and for acknowledging the Trump administration has done a great job in healthcare, and from his first administration to his current administration. And I think having transparency is something that's critical and something that our president has acknowledged is important. My question on that same line, since CMS has really made this a priority, and he's made it a priority twice because it wasn't upheld and enforced, and he's come around again to say this is critically important. This bill, how does this bill really, I know you went through it quickly, and I appreciate the quickness of it, but my concern is if the CMS has already brought this up back, and it was important enough to the Trump administration to address it again, there are hospitals in this state that are in 30 different states. Are we looking at legislation and transparency, that 30 different types of legislation, so that how will they be able to make sure that they are compliant versus just following this template that the federal government has given us?
Steve Yeager, for the record. Chair, if you would, I think Mr. Fenberg from Colorado really is the expert on what's going on around the country and can help answer that question about how this might be different from other states or the federal legislation.
Thank you, Mr. Chair, and thank you for the question, Senator. We wrote this bill really intentionally to ensure that if a hospital in Nevada is complying with this bill, then they will automatically be in compliance with the CMS rules. So they won't have to have two different files to make sure they're meeting different requirements. Essentially, one is kind of nested within the other, and they will be able to be in compliance with federal and state rules and laws at the same time. The difference really is that this law, AB 343, allows the state to have more of a conversation with their hospitals on the ground, something that CMS obviously will struggle to do with just how many hospitals and how many jurisdictions that they would have to be involved in for adequate enforcement. The bill, as it stands, really allows sort of the department to say, hey, it's come to our attention that you might not be totally compliant in this particular area. And so we want to talk to you about getting you into compliance. It does not automatically go to fines or penalties, but really is a partnership to ensure that the hospitals are acting in good faith and that they are meeting the requirements of Nevada law, which will be the exact same requirements that will be at the federal level from CMS, essentially. In terms of what other states are doing, I don't know of any states that are going significantly above and beyond or departing significantly from CMS rules. I think if it's a hospital system that's in multiple states, if they essentially apply the Nevada regulations to all of their systems or all of their hospitals within their system, then they also would be in compliance with federal law. So it really is meant to be complementary. And instead of being additional regulation, really mostly just about making sure that each individual state has the ability to enforce it, if and especially when CMS doesn't have the ability to do actual, on the ground enforcement and have that long-term relationship with the hospitals to make sure they're serving their community and getting consumers what they need before they get their surgeries or their operations.
Can I have a follow-up, Mr. Chair? So thank you for that, and I would like to address you directly then, Mr. Colorado. I think, I'm wondering that, how long ago did Colorado pass this law? What I want to look at, was there a benefit? How long ago did you do this, and has there been a benefit to consumers, just as a perspective before we go down this road?
Yeah, thank you for the follow-up, and thank you, Mr. Chair. Steve Fenberg again for the record, or you could also call me Mr. Colorado. I kind of like the ring of that one as well. Yeah, we actually passed this law a handful of years ago, so it's relatively new. And Patrick Neville, who's also on the line, really is sort of the godfather of that. I voted for it and I co-sponsored it, but he really was the guy who made it happen. But we saw compliance in Colorado that was very similar to the rest of the country, low 20% or so in terms of compliance from our hospitals. We passed that law, did a lot of education around it because of the passage of that law, and compliance shot up almost immediately to more than 70%. So we know it works. And it's not because it's a stick and you're penalizing hospitals. It's because you're just simply having that conversation at a local level and making sure the regulator and the hospital together are ensuring that they're in compliance. But we saw the impact almost immediately.
So if I follow up on that, so thank you for that. And so you passed it 6 years ago, and compliance increased 70%. But I think what I'm really seeking is, was there better patient outcome, and did you lower the cost of healthcare?
Yeah, thank you for that. Steve Fenberg for the record. I can't definitively say it lowered the cost of healthcare. I think if there's any politician or regulator in America that can definitively say that about one particular policy, they'd be famous. But what I can say is that we know it's been successful because we know that consumers and patients have been checking to see what the cost of their service will be prior to going in. And presumably in a free market with information to educate yourself, that means you're making a better choice for you and your family. And so, this really is about empowering consumers as well as employers, as well as unions or anybody else who's purchasing healthcare in that way, and making sure they have the information they need to make a better decision as a consumer. And then if and when there is a situation where they are overcharged or they're charged something that feels unreasonable, they then have the tools to look into that and see if that hospital was acting in good faith or if they were charged in a manner that might be predatory. And that's when they can take action by filing a complaint or something like that, and really having the tools to advocate for themselves. So that's the purpose. I can't say that, appendectomies were more successful after the bill passed, but I can say that consumers were empowered to make better decisions for themselves in their pocketbooks.
So to be clear, if I might continue, I'm a physician, and so I have recommended and referred patients to many different areas. And as somebody who's on Medicare and I like to pay cash for things, I too check what does it cost, and I want to know what I'm going to pay if I'm paying cash and with a high deductibles. I do encourage patients to call around and find out what costs are. So I certainly support transparency. I certainly support a consumer's involvement in their healthcare process. My concern always, it sounds great, but does it really solve the problem we're looking at? So anyway, thank you for the questions, Mr. Chair, and thank you folks for being here.
Thank you, Senator Titus. And I believe Patrick also wanted to, I saw that he was raising his hand, so I don't know if he wanted to add anything before we move on to Senator Stone.
Yes, sir. Patrick Neville, for the record, Patrick Neville. Mr. Chair and Senator, I just wanted to give you a personal example of the way this actually helped me out just 2 weeks ago. My daughter was in a bad car accident. She got a concussion, really bad concussion. It was her second concussion within a year. And I was able to easily go online and search because so many hospitals are compliant. So her pediatrician referred us to a hospital in Colorado. And I was trying to find the price, and I found the price, and it was just $1,000 for the facility fee alone. But because Colorado's so compliant, we have a bunch of tech aggregators in Colorado that made it super easy for me to go search. I was able to find that same MRI that my doctor recommended for my daughter for $420. Now, I'm on TRICARE, so it really doesn't cost me anything. I kind of know the copay is going to be $38 anyway, but I'm a good steward of the taxpayer dollars. So I was able to find it and say, oh my goodness, this hospital that's recommending my daughter for this MRI is recommended going to be $3,000. And that's going to be 2 weeks out for the MRI. I was able to get the next day about 25 miles closer to my house, and it was going to be $420. So I saved the taxpayer dollars. They ended up covering it through TRICARE, so I only paid $38, but it makes it easy for me to even like save the taxpayer dollars. So it's been wildly effective in Colorado, just getting those compliance rates. And I would just say the most like important factor here is making it as like local as possible as you can. So I think what this bill has done is give consumers some buy-in, so consumers can actually send these reports and send them to the AG, and they can actually give some input. I know, like myself, when I did any sort of policy, I wanted to be like regulated as closely as possible. And I, even being a conservative Republican, full disclosure, I didn't want the federal government coming in and telling my state what to do. And so this gives the state some authority over this, which is just a common sense policy.
Thank you so much, Senator Stone.
Thank you very much for the presentation, Mr. Speaker. You say that 35% of the hospitals in Nevada are compliant, and by inference, 65% are not in compliance. So would you say that the 35% that are in compliance, would they be compliant with this bill if it were a law today, or is your law different than the federal mandates?
Steve Yeager, for the record, thank you through the chair to Senator Stone. If they're compliant today, they would be compliant with this law. So nothing would change in that regard. Of course, there's always a possibility that someone falls out of compliance. That does happen on occasion. But this does not add any additional regulatory burdens that are not already in the federal rules and law.
Okay, if I can follow up. And then I noticed in the bill that says that you got to keep the data on the website for 7 years. I was curious as to why we needed to keep the data so long on the website.
Chair Steve Yeager, for the record, with your permission, I would punt that to our friends in Colorado, either Mr. Fenberg or Mr. Neville.
Thank you, Mr. Chair. Thank you, Mr. Speaker. Thanks for the question. The reason for that is because, as we all know, sometimes you get a procedure done and you're still dealing with the billing many months later, if not years later, potentially, if it got tied up in insurance dispute or something like that. If the way to empower the patient is for them to be able to look up what the price should have been on the day of the procedure, then you need to make sure that that the information they're looking up is relevant for that day. So if it's been a year and there's a new file posted on the website, the patient probably is going to need access to the file from the previous year to get the right information. Now, not everything changes every year, but some do, and obviously the hospital has a right to renegotiate their contracts whenever they would like. So that's the reason. We've been having conversations around making sure it's not burdensome, and if 7 years is the right amount, or if it should be 5 years. And we're obviously very open to reasonable conversations around that. But that's the purpose for making sure that some of the information is retained for longer than 1 year.
Lastly, in accordance with the bill, it has to be updated by the hospital once a year. Is that correct? Okay. So in these inflationary times, we see insurance premiums changing, copays changing, costs of procedures changing. If a hospital is neglectful and not quickly posting a change in a price of an MRI, for example, is this just an open opportunity for somebody to sue the hospital, or is there a remedy for the hospital to make a correction so that they're not able to collect the debt later because of the way the bill's written?
Steve Yeager, for the record, and I think I know the answer to that, but I'm going to ask Mr. Fenberg if he could answer, because I want to make sure it's an accurate answer to your question.
Thank you.
Thank you, Mr. Chair. Thank you, Mr. Speaker. Senator, the requirement in the law is that they will update the file once a year, or not less than once a year, which is in line with what the requirement is at the federal level. If a consumer looks up the file and It seems like the number was wrong, but in reality, it was right because they just hadn't updated their website. That would be okay. To me, if most hospitals are not updating their pricing that often. I think once a year is probably the standard, and it's why the CMS rule is what it is. Some probably aren't even updating it every year. But just a reminder, there is no private right of action or lawsuit ability for that patient. So it would simply be a conversation with the hospital or the billing department, figure out what the actual price was supposed to be, and maybe a conversation with the regulator to clear it up. So it would be in the hospital's best interest to ensure that their pricing on their website is up to date and current, so they don't have to deal with those types of disputes that are not relevant. But if they hadn't, I think there would be an easy way to remedy that and clarify the information. And just a reminder, if they didn't do that, it would not lead to a lawsuit. It would simply lead to filing a complaint on the regulator's website and probably having a subsequent conversation once that complaint is filed.
Vice Chair Taylor.
Thank you, Chair. And thank you, Mr. Speaker and co-presenters. And always thank you to the interns. Your extra love. Just a couple of questions. Because I'm not an attorney, and I don't play one on TV, will you explain private right of action versus the other piece? I'm taking notes. It's like, I don't even know what that is.
Steve Yeager, for the record, through you, Chair, to Senator Taylor. It's a good question. So a private right of action just means that the individual can sue the hospital. They could file a lawsuit directly against a hospital. We don't have that here. So basically, your remedy would be to make a complaint to the Attorney General's office, and then the Attorney General will sort of go through its process. But and now that you've asked about private right of action, I'm going to say that you're going to hear it way more than you think from here on out. And, that was a point of contention on this bill on the Assembly side with particularly our chambers of commerce, right? They're always very sensitive to private rights of action. They want to make sure that lawsuits aren't abused. And so that was one of the compromises we made in the bill, was to take that out and say, we think we have enough resources on the state level between the Attorney General and the regulator to make this right. So it's not going to be a situation where a hospital is going to get, sued by 150 people because their price list wasn't accurate on one day. Instead, it's going to go through the state process.
If I may. Thank you so much. And there's a phrase for that process. Not a private right of action, but a something. It was the way that you said it. What's the other? Oh, deceptive trade practice. I said, see, thank God for the intern, Mr. Speaker. Good thing you're here. Good thing you're here. Okay.
So Steve Yeager, for the record, thank you, Mr. Volk, and through the chair to you. Exactly. So there's already law around what is a private right or what is a deceptive trade practice. So we're simply adding this to the list. So the Attorney General generally already has purview over deceptive trade practices as we define them in the statute. So we're adding this to the list of things where they could take action if they found fit to do so.
Okay. Thank you so much. And thank you, Chair.
Any other questions? I have a question for Mr. Colorado, maybe. We're gonna hear. I've had many meetings about this bill. There are concerns that the bill provisions are more extensive than what the federal requirements are, and that this is going to be very onerous to hospitals and so forth. But it's my understanding that some of the hospitals that exist in this state also exist in your state. So can you please talk to us about the implementation of the bill and whether or not, I think we kind of covered it of the compliance, but more so of what has transpired since the bill has been passed.
Yes, thank you, Mr. Chair. Steve Femberg again for the record. Like I said, the bill or a similar bill was passed in Colorado, and compliance almost immediately shot up to more than 70%. Our belief is that the hospitals that are not in compliance can get into compliance very easily and very quickly. Sometimes it is literally that they just haven't taken the time to update their file and make sure that every procedure has an actual price instead of an NA or a blank in the cell. So it really is just, if there's no reason to be extra careful in the compliance, sometimes entities won't be. But if it's gotten some attention and maybe there's been a news article or two and it's a new law, then we often will see compliance shoot up. We haven't seen a lot of penalties or fines or anything like that in Colorado. I don't know if we've seen any, to be honest. We do have what we call a private right of action in Colorado that is not in this law. And I think there's only been 2 cases that were filed in the last several years that this new law existed. So I don't think you'll see this translate into a plethora of complaints or anything like that. And then lastly, I would just say, for the most part, this bill really is in line with the exact same regulations at the federal level. There is some guidance at the federal level that we think would be different in Nevada, but the actual letter of the law, if you compare the regulation to what is in this bill, they really are the same requirements. And there's the federal government actually analyzed what the cost or burden of compliance would be, and they estimated that it's probably about $12,000 per hospital to make sure they have an updated spreadsheet with pricing that's kept up to date and current on the website. So it's very minimal for a hospital system, of course, to be in compliance, to do that one time to ensure that they have the pricing available. And we assume that cost or that burden would be very similar, if not almost zero, because theoretically they should already be in compliance with the federal law. And that itself only costs $12,000 is the estimate.
Great. Thank you so much. Any other questions? Let's move on to the testimony. So if you would like to testify in support of this bill, we ask for folks to please come forward. I will put the 15-minute limit. So all of the bills, just again for reference, have a 15 limit. So 15 in support, 15 opposition, 15 in neutral. So let's begin here in Carson City. And if there's folks in Las Vegas as well, please come forward. Please begin.
Hello, Chair Doñate and members of the Senate Health and Human Services Committee. My name is Carissa Pierce, Carissa Pearce, and I am here representing Children's Advocacy Alliance. CAA is in support of AB 343 to enforce transparency of healthcare costs in hospitals. We see cost transparency helps families make informed decisions about their care and about their children's care, and often alleviates the anxiety associated with accessing healthcare, particularly related to receiving a bill weeks after receiving treatment and having the cost be more than what was expected or initially presented. So we support this bill as a step in the right direction to bring hospitals in compliance and back to being places of healing and away from being a monopoly for making money. Thank you for considering this bill and for keeping children and families at the forefront of your minds while you're voting on bills. Thank you.
Good afternoon, Chair and member of the committee. My name is Dr. Hito Norhatan. For the record, it is spelled Hitonorhatan. I live in Spark, and I'm currently undergoing treatment as a stage 3 cancer patient. I'm here today to express my strong support for Assembly Bill 343, because for cancer patients like me, understanding the charges is a matter of survival and fairness. Throughout my treatment, I've been hospitalized several times due to complications. However, the most shocking aspect for me was not the diagnosis or the procedure themselves, but the bill that arrived weeks after I returned home, a staggering $117,000 in total. To make matters worse, many of the charges were vague, confusing, and unrecognizable. At a time when I should be focusing on my health, my family and I are instead consumed by fear. Fear not just for cancer, but for financial devastation. And I'm not alone. In speaking with other cancer patients, I have heard the same story again and again. Patients already fighting for their lives should not have to fight to understand the cost of their care. The reality is that some of the largest hospital systems, while claiming nonprofit status for tax purposes, continue to impose massive, unpredictable bills on patients without clear explanation. It is not just unfair, it is unacceptable. Therefore, I urge you today to stand with patients, to stand with families, and to choose transparency over unchecked pricing practices. Thank you for listening to my story, and thank you for your consideration.
Good afternoon, Kaylin Cardavani, Kardavani, on behalf of New Day, Nevada. We support AB 343 and hospital price transparency. Nevada patients and families should have the right to see what something costs and make an informed decision before they are potentially subjected to mountains of medical debt and random bills. Nevadans deserve to have the ability to make the best decision for their health and finances, and AB 343 takes that important step forward. Thank you.
Kent Irvin, K-E-N-T-E-R-V-I-N, for the Nevada Faculty Alliance in support of the bill. Some years ago, the Public Employees Benefits Program started what they call a consumer-driven health plan. The theory was that if you had a high deductible so that the patients had skin in the game, they would be able to research and save money by comparison shopping. Well, you can't comparison shop if you can't see the data in an easy way. I'll spell you the personal story about how hard that is, but we support the bill.
Good afternoon, Chair and Committee. My name is Sabrina Schnur, S-A-B-R-I-N-A-S-C-H-N-U-R, and I'm here on behalf of the Leukemia and Lymphoma Society. We would especially like to ditto the doctor from Sparks. My favorite line he said was, "Patients already fighting for their lives shouldn't have to fight for their bill, too." Thank you.
My name is Aisha Goins, A-E-S-H-A-G-O-I-N-S. I'm here on behalf of SCIU 1107. Chairs and members of the committee, SCIU Local 1107, representing healthcare workers across Nevada, strongly support this bill. When patients can't see hospital prices, they're essentially buying healthcare blindfolded. This bill tears off the blindfold and allows the patients to see. We urge you to support this bill. Thank you.
Thank you so much. Anyone else in Carson City? I don't see anyone here in Las Vegas AVH. Is there anyone online?
If you'd like to testify in support, please press star 9 on your phone to take your place in the queue.
Thank you, Chair and members of the committee. My name is Shelby Swartz, and I am the Executive Director of Battleborn Progress. But I'm also here today as a mother who experienced firsthand the frustration, confusion, and financial burden of hospital billing after an unexpected C-section. Like so many mothers, I went into labor experiencing to have a straightforward delivery. The childbirth is unpredictable, and I ended up needing an emergency C-section, a decision made quickly by my doctors. In that moment, I had no time to compare costs, shop around, or ask for a breakdown of hospital charges. My priority was my baby's safety. The real shock came later when I received an exorbitant hospital bill, even after my insurance. No one had told me what the charges would be ahead of time, and I had no way of knowing if the costs were fair or inflated. Worse, as a brand new, exhausted mother, the responsibility fell entirely on me to call the hospital, navigate complex billing departments, and request an itemized receipt, something that is public knowledge in parenting groups as a way to significantly reduce hospital costs. I want to put an emphasis on that it is widely known in parenting groups and due date groups that simply asking for an itemized receipt can make a hospital bill dramatically lower. If those costs weren't arbitrary, why would this happen? And why would any patient have to play a guessing game or fight just to be charged fairly? This bill would make hospital pricing transparency from the start so that patients like me who are already dealing with one of the most vulnerable moments of their lives aren't blindsided by unfair billing practices. I urge you to support this bill so that no mother and no parent has to go through what I did. Transparency should not be optional. It should be the law. Thank you.
Chair, members of the committee, Jonathan Norman, N-O-R-M-A-N, with the Nevada Coalition of Legal Service Providers, ditto, and support. Thank you.
Chair Doñate, Vice Chair Taylor, members of the committee, thank you so much for the opportunity to provide some brief remarks at this critical moment in the movement for healthcare affordability. My name is Aaron Plotke, A-A-R-O-N-P-L-O-T-K-E, and I'm the Associate Director at Families USA, a leading national nonpartisan voice for healthcare consumers. I'm here today to convey Families USA's strong support of AB 343, which has the power to promote meaningful healthcare price transparency in Nevada by codifying a strengthened version of the federal hospital price transparency rule into state law. This legislation could not come at a more important time as Nevadans and Americans across the country are experiencing a severe healthcare affordability crisis. While every person and family should have access to high-quality, affordable healthcare, nearly 60% of Nevadans report delaying or foregoing needed medical care due to the high cost. And we know a leading driver of this crisis is high and rising healthcare prices, and in particular, hospital prices, which are causing millions of Americans to go into medical debt and workers losing thousands of dollars in lost wages due to rising premiums. In Nevada, hospital prices have consistently made up the largest source of healthcare spending in the state and are some of the highest in the country. Consider Las Vegas, where hospitals are charging nearly 20% more for the same care than the nation overall. And as we're seeing in Nevada and across the country, large healthcare corporations have destroyed healthy competition, which has allowed them outsized market power that they then use to dramatically increase their prices year after year. Fundamentally, hospitals are able to do this because they can keep the underlying price of healthcare services hidden from public oversight and scrutiny. And despite federal price transparency rules, large hospital corporations, including those in Nevada, have mostly subverted the federal requirements and are actively working to keep their prices hidden. So codifying strengthened federal price transparency requirements into Nevada law, as well as strengthened enforcement as AB 343 does, is a crucial step to holding the healthcare system accountable for irrational hospital prices and to make healthcare more affordable and accessible for all. Thank you so much for holding this hearing. Appreciate it.
Hey there, Eric Waskowitz at WASKOWICZ with United States of Care. We're a nonprofit, nonpartisan organization working in Nevada to support this bill. We believe it represents a strong step toward greater transparency and allow Nevada patients to more easily compare data when they're deciding to read their care. In addition, AB 343 also requires Nevada hospitals for the first time to report on any facility fees they charge patients. Currently, it's next to impossible for Nevada families to predict or plan for these surprise costs, which can range from $15 to hundreds of dollars out of pocket. Requiring hospitals to report to the state information on the facility fees they charge, as at least 9 other states do, would help policymakers develop future solutions to protect patients from these unexpected costs. Thanks so much for the opportunity to testify in support of this legislation.
Chair, there are no more callers in support at this time.
Thank you so much. Let's move on to opposition testimony. If you are opposed to this bill, please come forward. And we'll start here in Carson City. I don't see anyone in Las Vegas, so please begin.
Good afternoon, Chair. Oop, breaking the thing. Good afternoon, Chair Donate and members of the committee. My name is Jesse Wadhams on behalf of the Nevada Hospital Association, and we are opposed to AB 343 as written. Since 2007, Nevada has been at the forefront of hospital price transparency. Members of this body created NRS 439A 270, putting hospital charges publicly available online for the last 18 years. Price transparency is not our objection here. We comply with Nevada and federal law. Both regulators check our compliance regularly. This bill is an overly complicated addition to existing laws. Here are some of the Nevada-specific mandates. Disallowance of the online price estimator tool. Posting by tax ID number each health plan price. Posting of each third-party contract by a hospital, potentially adding thousands of new entries to the database. Sending these data files to DHHS, potential cancellation of medical debt for being accused of being in noncompliance, monetary penalties 6 times greater than federal law, and a new unrelated billing process that contrasts with current laws on billing and collection, which is found in NRS 449A 100 through 165. A violation of this provision could become a class action with penalties of $10 million, among other changes. Now, we've had great conversations with the sponsors and will continue to do so. We have proposed amendments to bring this bill closer in line with the federal law, and we remain committed. Just 2 months ago, the Joint Committee on Health and Human Services talked about the fragile state of Nevada's healthcare delivery system. This bill adds to those costs by being a different system than what is in federal law. We do look forward to working with the sponsors and continue to work in good faith on it. I appreciate your time, Senator.
Good afternoon, Chair Donate and members of the committee. Allison Herzik, Director of Nevada Government Relations for Dignity Health St. Rose Dominican, a member of Common Spirit Health, a nationwide nonprofit faith-based health system with 7 acute care hospitals serving Nevadans in the Las Vegas Valley, here today in opposition to Assembly Bill 343 as written. Through both Dignity Health and Common Spirit Health, we have worked directly with CMS to ensure that the data fields we report are meaningful and searchable for consumers. We are proud to share that all of our hospitals are in full compliance with federal transparency laws. We recognize the intent behind transparency efforts and support policies that help patients make informed decisions. We are asking that such state-level regulations mirror those at the federal level. This bill, as written, will create costly and complicated administrative burdens that lessen our ability to fund our mission-driven charity care and low-cost community health programs. Our focus is to ensure patient access to information while preserving a consistent regulatory environment that does not overburden our patients or system. We hope to continue conversations with the bill proponents to ensure these important goals are achieved. Thank you for your time.
Thank you, Chair and members of the committee. Blaine Osborne, Nevada Rural Hospital Partners, for the record, here in respectful opposition to AB 343 today. I would invite you all to go to any of our hospital websites and pull up the price transparency files and look for yourself what being in compliance with the requirements looks like. Currently, CMS is auditing 200 hospital files across the country per month. And all of their enforcement actions are posted online, so you can see how many times hospitals in Nevada have been checked and which hospitals. And what happens currently is when CMS finds a hospital to be out of compliance, they're given a 90-day window in order to get into compliance. At that point, if the hospital doesn't, then they are given another 45 days to do a plan of corrections with CMS. And if the hospital still willfully ignores all of those things, at that point, they will be issued a civil monetary penalty from CMS. And currently only 18 fines have been done across the country. Those are 18 hospitals that have willfully ignored it. With all that being said, our biggest concern with AB 343 is Section 17, and the idea that you would not be able to collect medical debt, collect payment for services during those windows in order to be in compliance is very difficult for us. Thank you.
Chair Dunyate and members of the committee, Connor Kane on behalf of HCA Healthcare, which includes our state's largest safety net hospital, Sunrise Hospital and Sunrise Children's Hospital, respectfully in opposition to Assembly Bill 343. We are not opposed to transparency like many of our colleagues and have expended significant resources and time to comply with complex federal transparency requirements. We believe that alignment with existing federal requirements is imperative, as any deviations can quickly multiply the operational burden on hospitals with no additional benefit to patients. Perhaps most importantly for patients, alignment with federal standards would provide consistency and prevent confusion. We look forward to the opportunity to continue to work with the sponsor and proponents of Assembly Bill 343 to ensure that it aligns with federal requirements, but unfortunately remain opposed at this time. Thank you.
Thank you, Mr. Chair. Dan Musgrove with Strategies 360. Excuse me, here on behalf of the Valley Health System of Hospitals, and I would just echo the comments of my partner hospitals in the Nevada Hospital Association and add me too. So thank you, Senator.
Thank you, Senator Michael Hillerby on behalf of Renown Health. Won't belabor the points made by colleagues in opposition to the bill, but just want to point out our number one goal at all times is the highest quality care for our patients. Transparency is annexed to that. That's very important. But added complications, and you've already heard about that, the additional fees, fines, penalties through lawsuits and potential class action does not do anything to advance that goal of high quality patient care. We do support transparency. We are supportive of the federal effort. As others have said, would like to see the bill match more closely with the federal effort that's always going on, because it does not come without expense. And be sure that those compliance issues are always focused primarily on, again, the highest quality patient outcomes. We don't see that in the punitive measures in this bill, but we'll obviously continue to work with the sponsor and others to see if we can come to something that works and actually benefits patients. Thank you.
Thank you, Chair Dunyate and committee members. Misty Grimmer, representing North Vista Hospital, the only hospital in North Las Vegas. And I will not belabor the point. I think my colleagues covered all of the issues quite well. We do have serious concerns about the bill and hope that we can get to some resolution with the speaker and the sponsors. Thank you very much.
Thank you. Anyone else? AVH, is there anyone online?
If you would like to testify in opposition, please press star 9 on your phone to take your place in the queue.
Cyrus Hojjati, Hojjaty. I stand in opposition. I appreciate the efforts in the bill. We need serious reform in our healthcare system. Transparency is one of them, but I will ditto the opposition comments. I just don't believe this is the bill to do it. And not to mention, it's got about 90-something, correct me if I'm wrong, opposition. So thank you so much and look forward to reforming our healthcare in the future.
Chair, there are no more callers in opposition at this time.
Thank you so much. Let's move on to neutral testimony. If you would like to testify in neutral, please come forward. And you may begin.
Good afternoon, Chair Doniate, members of the committee. For the record, my name is Nick Schneider, Director of Government Affairs for the Vegas Chamber. The Chamber was originally opposed to the bill as it was originally introduced, and we've been actively working with the bill sponsor and the proponents to address our concerns regarding the private right of action and the fines violation. We really do appreciate that partnership with Speaker Yeager. Really appreciate the clarification as well that private right of action has been removed. Pending the drafting of that proposed amendment, we're happy to stay neutral so long as that private right of action piece stays out. Thank you so much.
Thank you so much. Anyone else? AVH, is there anyone online?
To testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you so much. Any closing remarks? Go for it.
All right, Taylor Volk for the record. I just want to keep it short and sweet. We just urge your support on this bill. I believe transparency is vital for healthcare, and we will look forward to working with opposition at this time. Thank you.
Thank you. I think we had a question from Senator Titus. I don't know if Steve Fenberg is still online. I can't see him from the Zoom. I don't know if you're able to answer just a quick question from Senator Titus, please.
Yeah, I'm sorry, and I appreciate you still being there, Mr. Colorado. Much grateful. My question really was, in your Colorado, if this is an exact template of the Colorado legislation, what was the purpose of having all the negotiated contracted rates in your bill? As contracts for different services change all the time, different systems, whether you have different insurers that you contract, different insurance companies, different providers that you contract with, those contracts aren't always up at the same date. Did Colorado have this in your bill, these contracted rates with providers? That's different than having a transparent charge of what an MRI costs. Significantly different.
Thank you, Senator. Thank you, Mr. Chair. Steve Fenberg for the record. Just for the record, that this bill is not identical to the Colorado law. There are some differences, but that particular aspect that you're asking about essentially is the same because that it mirrors the federal requirements. So the information that's required to be in the file or in the spreadsheet that's on the hospital's website is exactly what is in the federal CMS requirements. So we didn't invent that. That is just a replication of the federal law. And the reason is because every individual, as you know, our healthcare billing system is very complex. And almost literally every individual is kind of a unique situation depending on their employer and their plan and the hospital they're going to and where they are in their deductible and all of that stuff. So the reason why, it's supposed to be in there, the reason why CMS requires it is to, no matter who you are in America, if you look up the price of what the MRI will cost you, you should be able to get an answer. And so it does require that the file provides the charge master price. You probably know the charge master price is kind of meaningless to a consumer because it's almost never what they actually will be charged or what they have to pay. It does provide what the out-of-pocket cash price would be, which can be very useful. And then it requires to provide what the price would be if they went through their insurance provider. So that we think is the information that a consumer needs to be able to decide, should they pay cash, should they go through insurance, or should they look at a different hospital because it might actually be cheaper if they compare the prices.
Thank you so much. I think that concludes our questions. So I'm going to go ahead and close the bill hearing and thank our presenters for joining us. I'm now going to move, if you give me a second, to open the bill hearing on AB 185, and I will invite Assemblymember Anderson. There she is. This bill revises provisions relating to child care, and you may begin when your team is ready.
Good afternoon, Chair Donate. I'll make fun of Vice Chair Taylor later, and members of the Health and Human Services Committee for the Senate. My name is Natha Anderson, and it is my honor to represent Assembly District 30. Thank you, Chair Donate, for allowing me the opportunity to present AB 185. AB 185 deals with an issue that many of us are aware of, but many of us actually are not personally part of. It deals with home-based childcare. In particular for our children that are under the age of 4, where exactly will we be, how exactly do we help them get that childcare? Whether it's childcare education or traditional childcare services. Before actually going into the meat of the bill, I just want to bring up a few little studies that have been done or statements that have been made. The first comes from the Center for American Progress. It was a report from January of 2025. Child care and early learning programs are foundational to any well-functioning society, providing large and lasting economic and societal returns and setting children up for success in school and beyond. Or, from 2 years ago, the February of 2023, Governor's Office of Workforce Invention, the GOIN. The Governor's Workforce Development Board released a child care report, and these findings, first they did a press release, which I believe has been uploaded as well. And this finding shows that there are inadequate access to child care centers, which is creating barriers for working families and impedes our economy. From the press release, 74% of Nevada children ages 0 to 5 do not have access to licensed child care. In Nevada, child care is often more expensive than in-state college tuition. Let me make that clear. These are our 3-year-olds, our 4-year-olds. They cannot get a job to help pay for their college education, and yet it's more expensive than that. Nevada is a child care desert, and every county, every single county, not just our most populous, due to not having enough infrastructure and child care workers, and the capacity building in both areas is needed. And finally, child care facilities should not be a one-size-fits-all model because of Nevada's key economic industries, whether it's mining, hospitality, warehousing. All of these are 24/7 around the clock. So around the clock access is needed. The idiom of how do you eat an elephant lends itself to this issue. The bill that's being presented today is one small, very small solution. Very small step towards a solution towards this. And that is actually providing more access by the space. And before I hand it over to my co-presenters, I just want to say also, as a high school English and civics teacher, this time of year it's very tough not to be in school. I mean, I love serving in the legislature. I want to make sure that's clear as well, because I get to actually practice what I get to teach my students. But in the next 3 weeks, my students are graduating. I don't get to be part of that excitement. Next week, they get their caps where they will start to decorate them. They get their gowns. They're starting to get a whole bunch of other great things. And the end is near for so many of my students. But I realize as a high school teacher, they're preparing for this graduation actually takes place when they're 3 and 4 years old. This is one reason why I'm bringing this bill forward. This foundation makes a difference for the students who I get to teach when they are in 12th and 11th grade. So I would like to, if with the chair's permission, hand it over to Denise Tanada, of the Children's Cabinet, who can go into the early child care information in a much deeper way, and also we have the PowerPoint. Denise?
Thank you, Assemblymember Anderson, and thank you, Chair Dunyate and members of the committee. As mentioned, my name is Denise Tanada. I'm an Early Childhood Comprehensive Systems Advisor with the Children's Cabinet. So just want to help kind of lay the foundation for this bill and why we need it so much. So one of the documents that I believe you were provided just before the hearing is the 2025 Early Education and Care Fact Sheet. This has some more detailed information on where we're at in terms of child care in the state of Nevada, but we also wanted to point out a few specific pieces. As the Assembly member mentioned, Nevada remains a child care desert. As you can see from this first slide, we have a limited supply of child care in the state of Nevada, licensed child care. Our licensed care meets only about 36% of the demand for children ages 0 to 5 who have all parents in the workforce. Our report that just came out this year that looks at data from 2018 to 2024 for licensed childcare actually found that we had a 55% decrease in family childcare during that period. And so there's a lot of reasons for that. We've done a lot of work over the past couple of years really trying to address how we expand access, how we expand quality child care, and how we increase affordability. And so as was mentioned in the opening, this is one of the issues that we've identified specific to our family child care providers. So just wanted to also make sure that we're all on the same page. When we're talking about home-based child care providers, there were really 3 types. The first type is license-exempt home-based child care providers, or as defined in NRS, small child care establishment. And those are those that are caring for 4 or less children in their home. They are not required to get a license. They're not required to get background checks, home inspections, anything. So they can care for 4 or less children in their home, be paid, and not have to go through any of those requirements. Just to be very clear, for the specific provisions that we're talking about today in this bill, it does not include those license-exempt home-based providers. The 2 other types of home-based providers are family child care centers, so those that are caring for 6 or less children in their home, or group family child care that are caring for 12 or less children in their home. Those are both licensed child care providers that are providing care inside of their home that they reside in. They have to follow requirements for licensed providers as developed by child care licensing, which currently is just administered by the state of Nevada. So doing things like background checks, home inspections, having to meet a lot of requirements. They also have to follow all the health and safety, so local health department regulations, fire safety, if required by their local government, zoning special use permits. They're required to have liability insurance. They also have 24 hours annually of continuing education units that they have to comply with. So these are just some of the examples of the requirements for those home-based providers. And with reductions in child care subsidy funding resulting in changes to income eligibility criteria, expanding access to cost-effective options that also maintain the quality and safety standards that are afforded by licensed settings is critical. Home-based child care offers the most effective cost option for working families. So improving access and quality in these settings will also support parental choice for pre-K programs as we look to expand a mixed delivery model for our state pre-K, including districts, child care centers, and home-based child care providers. So at this time, I'd like to also hand it off to our other presenter in Las Vegas, Ms. Deetra Stewart, who is a home-based child care provider.
Good afternoon, Madam Chair and members of the Senate. My name is Deetra Stewart, and I am a home-based educator. And I am also the Family Child Care Association, Child Care Association of Nevada president. I have been a family child care provider for over 30 years. Today, I am here to express my full support for AB 185, which successfully passed through the Assembly and now stands before you for consideration. AB 185 addresses a critical issue impacting families and home-based educators across our state. This is the right to operate a licensed, safe, and regulated child care business from our homes, even when we live in communities governed by a HOA. Home-based educators are essential to Nevada's child care system. We offer high-quality care and education to children in our communities. Additionally, we offer flexible hours to working parents that is not offered typically by center-based facilities. We support families with culturally responsive environments and the comfort of care that feels like family. Yet, many of us are faced with discrimination or restrictions simply because of where we operate. I have personally had an experience and faced this challenge. After years of serving families in my community, my HOA tried to shut down my program. I had to fight for months just to continue providing care that was already licensed, insured, and compliant with every regulation. AB 185 changes that. It ensures that licensed child care providers are able to do business that are able to do business and can't be treated unfairly or targeted or shut out by HOA rules. It brings fairness, clarity, and opportunity for home-based educators and families. I urge you to support AB 185. Let's stand together for children, for equity, and for Nevada's future. Thank you.
Thank you, Ms. Stewart. If I may just have a little bit more to go over, I think one of the important reasons why we are bringing forward an HOA bill and specifically is the fact that during the commission report, the Commission on Common Interest Communities and Condo Hotels report, Perry Fagan of the Deputy Director for the State of Nevada Department of Business and Industry stated that almost all, if not all, new developments in Southern Nevada have HOAs associated with their development. All municipalities require this as part of their planning and permitting process. So what that means is we've got more and more people that are moving into these communities as we build more houses that will have young children and yet not be able to have those neighborhoods, that we could have a smaller area to have it, or to have the home provider family childcare. You'll notice that at this time statewide, there are 3,699 registered homeowner associations, which equals to 608,000 total units. AB 185 is attempting to address the issue in a succinct and fair fashion. Since our March hearing in the Assembly, a few issues were raised, and I believe one of the amendments, as presented by Ms. Tanada, addresses the concern for the outdoor space required to be within a mile. That would be mostly for our apartment complexes. That has been removed and instead replaced with language that is similar to what is present in statute for on-site child care facilities of multi-unit dwellings. That is considered to be a friendly amendment. In the last 24 hours, just last day, I have worked with a few stakeholders for 3 additional conceptual amendments to be added to section 1.4. I believe I emailed those to you earlier today, and then also please accept my apology for the lateness of you getting a hard copy of it. I will be uploading those to Nellis following this hearing, but wanted to mention them to you specifically. One part, a new section for 1.4, is nothing in this provision would exempt a homeowner or their tenant who is operating a child care facility in a common interest community from adhering to all requirements of the CCNRs adopted by the Board of Directors, including nuisance provisions or utilization of common areas. A concern was raised about parks and pools, although, again, I teach high school, so if I even take 1 3-year-old to a pool, I think there's something wrong, but if you take 2, forget it. But I greatly admire those that are willing to do so. So this would address that issue. Section 1, subsection 5, is the provisions of this section do not apply to a common interest community that is an age-restricted community pursuant to the Federal Housing for Older Persons Act. That age is set at 55. Our language is set at 50, but we will go with what the federal language says, if that is what is recommended. A next provision that we are asking for is a new provision of Section 1. Notice of application of licensure for the facility may be filed with the Common Interest Communities Board of Directors or agent as required by the HOA's common policies. The HOA may require a licensed child care facility to add the CIC as an additional insured to the liability policy, but may not require a policy limits greater than those required by the child care licensing entity. I have not had a chance to talk with the lobbyists with the HOA since last week. However, I'm hoping that these conceptual amendments will help address the concerns that were brought forward, and I'm more than happy to continue to have those discussions. But again, in closing, I would just like to state, actually one last slide that I almost forgot about. In May of looks like last week, you'll see that there's even more information provided about the newly registered homeowner associations in fiscal year 24, and the partial year at this time is up to 36. And so we still have a child care desert. This is an attempt to try to address one part of it. More than happy to answer any questions to the best of my ability, but thank you very much for this opportunity.
Thank you so much to our presenter, and of course, for those of you who presented. Let's go ahead and ask any questions. Who wants to go first? I'll go first. Let's do Senator Ling and then Senator Stone.
Okay, so I have a few questions, if that's okay, Chair. So I served on the governor's task force, and until last year, out of the governor's task force, did they recommend having childcare in HOAs?
Assemblymember Anderson, for the record, thank you for asking the question. I do not know, but I am more than happy to look that up. I have a feeling that you might know the answer.
I don't know
sure.
the answer.
I would hope that they did, but I'm more than happy to ask others that were on the task force as well as look for that report.
Okay. And then my other question is, HOAs have their CCNRs. I lived in an HOA. I don't now, which I love. But the people that live in the HOA have the opportunity to work with the board on creating rules for their HOA. And so, in some respects, I feel like we as a state with this bill are coming over the top and telling the HOA what they have to do. And I'm wondering, just from your perspective, why you think that's okay, because I honestly have a problem with it, but I'm just curious what you would have to say.
Thank you. Through the chair to Senator Lang, thank you so much for asking that, because I understand where you're coming from. I would agree with that as well. But when I sat down and started looking at both areas in my Washoe County district and some of the new communities that are being planned, those CCNRs are going to be in place now for many of the new places that are being talked about. The other issue that I found was that sometimes, as we all know, some of the HOA boards are not exactly open to allowing others to come in, and have made it very clear that this is how it's always been, this is how it needs to be. In doing so, we need to also sometimes make changes. There are too many HOAs that are not listening to what others are trying to do. And quite frankly, my opinion, I do not live in an HOA, it's important you know that. But from some of the CCNRs that I've read, some of the stories that I've been told anecdotally, it becomes a little bit, well, it doesn't matter what the government says, this is what we want to do. At some point, we need to be looking beyond just our house that we might be in ourselves, but also think about the whole community. We are having more and more communities that are being created that are HOA-based that will not be able to provide the child care services that we need. I believe that part of that data is because of the HOAs not being allowed to have them. That is my belief, but I will hand it over to others as well, if you'd like to add to it.
Denise Donato, for the record, just in response to your question, I think it's a balance, right? I lived in Las Vegas for about 30 years. It's really hard to find a home that is not in an HOA. It's one of the issues that we've actually run into over the past couple of years in working with some partners to try and expand access to home-based childcare. In particular, a lot of resources have been put into a Care Nevada program to actually purchase homes, renovate them, make them group family childcare. They're limited. They're limited on the inventory that's available for that because they cannot purchase in any HOA because of the potential of that HOA, even if they don't have rules in place right now restricting it, that they could potentially restrict it. And then we've invested a lot of money into those programs that would not be able to operate. I think the other side to look at it is, as a homeowner, do I have a say in what I'm able to do in my own home and how I'm able to operate that? I operate a business out of my home. I'm not having kids coming in and out. So I think it's a balance between what is in a very large, sometimes complicated document that maybe not everybody fully understands, and just having the choice. There's not a lot of choice, particularly in our urban areas, on living in an HOA or not living in an HOA.
Thank you.
If I may also have, I'm so sorry, Carissa Pierce of the Children's Advocacy Alliance also has one more answer.
Okay, I just let's try to be succinct because I'm trying to make sure that we get the bills heard all throughout today. So, yeah.
Yeah, absolutely. Carissa Pierce, for the record. I just wanted to add too that in our discovery of the new units that were added for fiscal year 24 and fiscal year 25, the partial year 25, 80% of those are in Southern Nevada. And so that means that 80% of at least the new units added are within HOAs. And so what we're seeing is that means that 80% of the new developments are not going to be able to have access to the childcare, home-based childcare.
Senator Lang?
But just to follow up on that, but don't the HOAs have the opportunity to create the rules to add childcare?
Carissa Pierce, for the record. Yes, we actually, when we were having conversations with the counties in the first when we presented in the assembly, they had some concerns for our zoning language, which is why we had an initial amendment to remove that. And the reason I bring that up is because we asked them if they had ever denied childcare, home-based childcare because of a zoning issue, and they pulled records and said the only times that childcare was denied was because the HOA blocked it.
Okay, and one last question, Chair. On your slides, Did you say, could you just refresh my memory about background checks? Because I thought you said in one particular category there wasn't a background check, and I'm just curious about that.
Assemblymember Anderson, for the record, that's actually in another bill that I'll be presenting next.
No, I did.
Oh, but you also said something. So sorry. Okay.
Thank you, Denise Tanada, for the record. Yes, if you're a license exempt provider, meaning that you're caring for less children in your home, you're not required to get a license. You're not required to get a background check. There are no requirements if you're caring for that small number of children.
Deidre Stewart, for the record. I live in an HOA community, and I really like my HOA community. There were definitely reasons that I chose to live in a HOA community. However, when we look at home-based educators, I think that there is an issue for me when a person can say, yes, you can vote on this and you can vote on that and you can vote on this. But when it comes to educating our children, and I have 6 children in my home that I am providing childcare for, and I can get the neighbor to the right or to the left or in back of me to say, you know, I don't want them to do that. To be able to vote that yes, you can have childcare in the community for this year, and then next year you can't, and then the following year you can, and then the next year you can't, just depending on who's your neighbor, doesn't seem like it's the right thing to do. So it's not so much about having the right as it is, what is the right thing to do? What should we be doing? And just speaking as a community, we recognize that we are in a desert, a childcare desert. What are we going to do as far as our entire state? When are we going to step up and say, what are our choices? What is the right thing to do? And it has to start somewhere.
Thank you, ma'am, for your question.
And there are
Thank you.
so many.
I wanted to let you complete your response, but we got to continue with our questions, please.
I get that. Thank you.
Thank you. Senator Stone.
Thank you, Assemblymember Anderson, for the presentation. And thank you for the amendments that you've taken, because those are some of my concerns, especially the insurance concern, the indemnification issues. I worry about a child getting hurt on a piece of gym equipment and filing a multi-million-dollar lawsuit against an association. Also, I had my concerns about age-restricted communities. And I thought that a great avenue for you with your bill would be looking at things prospectively with HOAs, because you're absolutely right. The HOAs seem to be the predominant associations that we're seeing in northern and southern Nevada. I live in an HOA. I'll be honest with you, I looked at the HOA documents before I actually bought into the development. In my development, I live in the Anthem area. You cannot have a business at all, whether it's child care or any other business for that matter. And frankly, I like that. Mostly other more active businesses, but would have been opposed to. The common areas, though, we have a playground, a pool, the gym. These are paid for by the homeowners through their monthly assessments. And I'll tell you, I don't have much heartburn with your proposal as far as being in single-family developments. My concern is the more dense, the condominium developments where you have somebody living above you, below you, to the right of you, to the left of you. People bought into these developments because they read the CC&Rs and they wanted to have habitability. They didn't want to have a lot of noise. They want to make sure that they had home, that they had a parking place for their cars. How do you address these issues with your bill?
Denise Schneider for the record. I think there's a couple things. One, we tried to address in the amendment that was submitted regarding changing their requirements. Honestly, we're going to have very few. It's going to have to be a very special apartment or condominium, very large apartment or condominium that would meet the space requirements. So if they have to have both indoor learning area, which has to be 35 square feet per child, in addition to indoor play area, which would have to be separate. That's, I think it's 37 and a half, I'm looking, 37 square feet per child, sorry. Ask a friend from licensing for support. So it's going to be rare for those type of facilities. They'd have to be fairly large.
Okay.
I hope that addresses your question.
I think it does. Thank you very much.
Thank you. Any other questions? I had a few suggestions, perhaps, if you're interested in them for post-hearing. Some of the concerns that I heard, first of all, I appreciate your amendment because I think it alleviates a lot of the concerns that we heard from the condominiums and so forth. The only thing that I would mention to you is I know you're looking at adding a new section 1.4. You included provisions on nuisance of noise and so forth and the utilization of common interest areas. I would just recommend that you consider ingress and egress of transportation. I know that's been an issue, especially for instance if you live in a cul-de-sac, and so I'm just giving that as a potential recommendation as well, since you already did that for noise complaints and so forth. Obviously, you're looking at Section 1, subsection 4.4 that deals with the exclusion for age-restricted communities. I think not to belabor the point, but I think Senator Stone has a point of condominiums are a little bit different than a single-family unit or household, and so perhaps that would be a mediation that you should look at post-hearing. And then I think there was one concern that was raised to me about how do we prevent folks from essentially, if now we're requiring HOAs to establish such policy, what's stopping me from buying 3 homes that are on the same street and converting all of those into childcare facilities, and now it becomes more convoluted. So I think you can solve a lot of these issues probably offline in the amendment revision. I do like the idea of being prospective if you wanted to look at that for new HOAs that are being stood up, especially as we're expanding our housing availability. And so just throwing that as an offer if you guys are interested in that, as I'm sure you guys can talk about it offline. But I don't know if you have any response. I just was giving recommendations. So
Thank you for the recommendations, obviously taking notes, and then more than happy to meet with you separately as well if you need to. Thank you.
All right. Any other questions? Let's move on to support testimony. If you'd like to support this bill, please come forward. And we'll start here in Carson City. If there's folks in Las Vegas, please come forward as well, and we'll go down south. Let's start here.
Good afternoon, Chair, members of the committee. Nick Ciccone representing the city of Reno for the record. We actually had opposed the bill in the other house. I had made a snafu and had not told Assemblymember Anderson beforehand. So one, I want to apologize for that, but she did take out the entire provisions that would have taken away the city's ability to zone properly. I think that addresses many of the issues that you've talked about with egress, talking about the condominiums. We do have, although we don't actually license childcare facilities, we do say where they can be. We look at maybe how close they are to maybe a cannabis establishment or prohibit that. And so that's why it's important that we thought that we could keep that that ability to regulate it at the local level. And so we appreciate that, and we believe that this is one part of the solution to solving the childcare crisis. But thank you very much.
Good afternoon, Chair Doniate and members of the committee. My name is Justice Forrest, spelled just like the word for both of those. And I'm here on behalf of the Nevada Association for the Education of Young Children, or Nevada AEYC for short. I'm here today because Nevada AEYC strongly supports AB 185 and the impact it will have in making childcare more accessible to all families in our state. We believe that home-based licensed childcare providers are a vital part of Nevada's economy and childcare ecosystem, and as such, we support the work that AB 185 provides in cutting red tape that inhibits these small businesses from operating within our state. As you know, the state of Nevada is home to many industries that have work schedules beyond the traditional 9 to 5 hours, including our gaming industry, warehousing, and manufacturing industries such as the Tesla Gigafactory on USA Parkway. For those workers, home-based licensed childcare facilities often provide access to childcare services that they otherwise would not be able to receive through traditional childcare facilities whose hours may not align with their schedules. By protecting the rights of providers to operate a licensed childcare facility in their home without excess and undue restrictions being imposed upon them, we can help to ensure that our childcare providers are able to support families across the state. For these reasons, we strongly urge you to support this bill and protect our service employees throughout the state. Thank you very much.
Good afternoon, Chair and members of the committee. For the record, my name is Annette Magnus, and I'm here today representing my client, Moms Rising Together. Moms Rising Together is a network of families here in Nevada and across the United States who are united by the goal of building a more family-friendly America. We are here today in support of AB 185 and thank the sponsor for this important bill. We know that access to good quality and affordable childcare is a crisis in the state of Nevada. This bill addresses one part of that critical shortage of providers. Nevada is at a crossroads on this issue. We have a choice to address this issue head-on with sensible solutions like this one, or we can continue to kick the can down the road while our families struggle to find access to care. This issue impacts families and businesses. On a personal note, my husband and I own a home in a community in Las Vegas with 2 HOAs in Mountain's Edge. We have no children. However, I would welcome these kinds of small businesses in our community. I am very involved with my HOA, and I have seen firsthand the problems with my HOAs when it comes to fairness and working with our community members. They often ignore what their neighborhoods want and operate as their own little governments with no oversight. I see the struggles of my friends who have small children. One neighbor is paying over $27,000 per year for her 2 small children as a nurse and a single mother. She struggled to even find space for her kids to attend childcare, let alone affording it. This bill would help her directly if we were able to have a provider closer to our homes and in our community, especially if it could be more affordable. The more access Nevadans have to care, the better. Please support AB 185.
For the record, my name is Mark Ellis, President of Communication Workers of America, Local 9413. In solidarity with Moms Rising Together, we support the bill.
Thank you so much. Let's go to Las Vegas, please.
Good afternoon, Chair Danyate and members of the committee. My name is Dr. Jamel Nance, for the record, and I am the Early Childhood Policy Director with the Children's Advocacy Alliance. CAA is a nonpartisan, independent voice for Nevada's children with a mission to ensure every child in Nevada thrives. We are speaking in strong support for AB 185, and as you all are aware today, Nevada continues to face childcare crisis with families struggling to afford childcare. We have issues with accessibility and quality. And so I do want to mention that the Governor's Office of Workforce and Innovation 2023 Childcare Policy Report on page 32 does suggest home-based childcare, particularly to address the issue of infrastructure. So I just wanted to mention that. We know that, right now HOAs can prevent licensed family childcare providers from operating in their homes, further reducing options for working parents. AB 185 removes this unnecessary restriction, allowing trained, qualified providers to serve their communities without HOA interference. Home-based childcare is essential, and it is even more affordable. It provides flexible hours for families working in non-traditional schedules, and it also helps fill the gaps with Nevada's childcare desert, as we've heard today. At a time when 10,000 children recently lost access to childcare subsidies and Head Start programs are under attack, we must be working to expand childcare options, not restrict them. AB 185 provides protects childcare providers, supporting working families, and ensures children have safe, stable learning environments. And so today we urge your support of AB 185 to give more Nevada families access to childcare that best meets their families' needs. Thank you.
Good afternoon. I am Carmelita Allen Ward. Thank you for this opportunity to speak. I am a child care provider. I have provided child care in my home for several years. I am in support of AB 185. I have a personal HOA horror story testimony. After serving my community for over about 2 years, I received notice from an HOA that there was a complaint. I reached out to my neighbors and I asked what was the problem. It was something minor. Long story short, it ended in a HUD investigation. 3.5 years later, thousands of dollars out of my pocket. The point is that I am providing quality education for working families. A lot of my families, children have been with me with our child care since infancy, and we provide such great fundamental educational development and things for these families. Not only do I provide services for my community, for the families, I also employ people in our community who use that income to provide for their families as well. There are a lot of questions about, certain regulations. We are highly regulated. There's a lot of restrictions with childcare licensing, with fire, with health, Southern Nevada Health District that we have to abide by, background checks, fingerprints. My husband, retired Metro Police officer, he resides in my home. He even has to get a separate fingerprint. So there's so many protections when we have home-based daycares in our communities. So I just encourage you guys to go ahead and pass this bill so that we can continue to provide this education, early education for our families and communities. Thank you.
Thank you. Anyone else in Las Vegas? AVH, is there anyone online?
If you'd like to testify in support, please press star 9 on your phone to take your place in the queue.
Good afternoon, Chair and members of the committee. For the record, my name is Riley Svensson, spelled RYLEY-SVENDSEN, and I am the policy specialist with the Nevada Coalition to End Domestic and Sexual Violence. We strongly support AB 185 because access to affordable, flexible, and reliable childcare is violence prevention. Concrete family support reduces household stress, preventing violence before it occurs, while also ensuring victim survivors can access the care needed to leave abusive relationships. By reducing child care barriers, AB 185 directly supports these crucial services, and we urge your support. Thank you.
Chair, there are no more callers in support at this time.
Thank you so much. Let's move on to opposition. If you are here in opposition to the bill, please come forward, either in Las Vegas or in Carson City. And we'll start here in Carson City. Please begin.
Mr. Chairman, thank you. Good afternoon, members of the committee. For the record, my name is Garrett Gordon. I am a real estate lawyer with the law firm of Womble Bond Dickinson. I do live in Senate District 15, so it is a pleasure to appear before my state senator today. Senator Taylor, good to see you. Today I'm representing the Homeowners Association industry group called the Community Association Institute, CAI. CAI advocates for the approximately 3,600 associations in Nevada. With over 3,600 associations and over 600,000 Nevadans living in associations, it is always very difficult when painting associations with one broad brush. One size definitely does not fit all. Of these 3,700 associations, some are located in rural counties, some in urban counties. Some range from a few dozen homes to over 10,000 homes. Some include condominiums and townhomes with shared walls, ceilings, and floors. Others have very large master plan communities like, who's with me today, Collin Ranch. In fact, given these differences, all of these associations have each individually and intentionally decided one by one whether or not they desire a commercial business and the impacts of that commercial business in their community. These impacts could include increased traffic on local private streets from vehicles living outside the association, congestion in cul-de-sacs, investors buying up properties to run commercial businesses in neighborhoods, noise disruption in a quiet neighborhood, especially condominium and townhome complexes, use of the pool, playground equipment, and other common areas by commercial businesses whose customers are not paying for the maintenance, the capital upgrades, the insurance for these common areas. These costs are solely charged to the existing residents living in the association who pay to use these facilities. Finally, liability to associations if these commercial businesses or its customers sue the association for some sort of injury into the pool. Again, lawyers, insurance premiums, and court costs are all paid for the existing hardworking residents. Given these concerns, we've been advocating for 4 amendments that we think provide reasonable guardrails.
Sir, if you can please complete your remarks.
Yes, sir. I have 4 quick amendments, if I may mention, Senator.
If you can submit them to the committee secretary, just complete your remarks, please.
Okay, no problem. In closing, we'll continue to work with the sponsor on amendments dealing with insurance, and we would respectfully request that condominiums are in fact exempted. Thank you.
Thank you. Please proceed.
Hi, I'm Lisa Nunley, Nunley. I am a member of the Legislative Action Committee for CAI, also Nevada Certified Supervising Community Manager and General Manager for Collin Ranch HOA. I'm here today to respectfully request that you oppose AB 185 in its current form. I understand that there are some amendments, and we really appreciate that, but there still are some other items that we feel are important, and they will be in those in the amendment request that Garrett provides to you. So if you oppose 185 now, it will give us more time to work with stakeholders, to work on amendments to make it more workable for the homeowners that live in the communities. Because currently, in its current form, it would significantly negatively impact the lives of homeowners in those communities. Some of those things, I got some time, that we're requesting is that the child care facility would not use the association's common areas, which are paid for and maintained by homeowners and created exclusively for their use, that the child care facility must be required to maintain commercially reasonable business insurance with appropriate limits, naming the association as an additional insured, that the child care facilities do not create a nuisance for existing residents, including excessive or unnecessary noise, parking congestion, or traffic that impedes access or creates safety hazards. And from the previous comments, this could potentially be all hours of the day and night. And that child care facilities should be required to obtain written approval from property owners within 500 feet. In addition to a couple other items. But as you can see, the very nature of this bill, as it's written, conflicts with the purpose of an HOA. Homeowners expect their homes to be in a peaceful neighborhood, not adjacent to a commercial business with unwanted noise, traffic, and other safety concerns. So we appreciate your consideration in opposing this bill, just in its current form. Thank you.
Thank you. Let's go to anyone else here in Carson City. Let's go to Las Vegas, please.
Good afternoon, Senators. My name is Mike Kozar, K-O-S-O-R. I've been elected to multiple boards, ranging in size, HOA boards in South Las Vegas from 250 units to over 8,000 units. I'm here in opposition to 185, and I provided a letter to you, which is posted on the bill, with a proposed amendment that I think would be very helpful, along with a lot of other amendments that I've heard here but have no ability to understand what they are. I would like to present the fact that I fully support the policy objective of improving child care delivery in the state. I think it's badly needed. My question becomes, is 185 the appropriate method of doing it? By the presenter's own words, 185 will be a very small bite out of a very big elephant. But in turn, in what has been mentioned a couple times, 185 is going to intervene in the contractual arrangements of over half the people in Nevada that live in HOAs. Is that appropriate? It is discriminatory, as I read it, because it eliminates or restricts apartment buildings, which I see as no different than HOA condo units, which are being included. Okay? I hear the term HOAs aren't listening. Frankly, we would always listen. That's not the problem. The problem is that the CCNRs in many HOAs restrict us. The contract we have restricts us from operating a business in the HOA. You're asking, and I heard one of the senators mention that, yes, this bill does ask you to intervene and tell the HOAs to disregard their contract terms and that you're going to step in. So the question becomes both constitutional, but also, is that the appropriate solution that you all want to seek? I would suggest it's not. I believe this can be addressed in other policy avenues, but 185, currently as submitted, doesn't meet the mark, and I would ask you to oppose it. Thank you very much for your time.
Hello, my name is Carolyn Glazer, Glaser. Thank you for letting me speak in opposition of AB 185. I am the president of Red Rock Country Club HOA in Clark County with over 1,100 homes and over 2,000 homeowners. I oppose AB 185 as written. Please consider amending the bill to allow the HOA to control the use of the common areas as it relates to the children from the child care facility to be able to use the HOA parks and facilities. And please amend the bill to require child care facility to have insurance, listing the HOA as additionally insured so that we could protect the other homeowners in the HOA in case of any kind of accident with child care facility. Thank you.
Thank you. Anyone else in Las Vegas? Please feel free to come forward.
Good afternoon. My name is Ben Wiebers, Wiebers. I own and reside in a condo HOA in Las Vegas. I strongly oppose AB 185 as currently written, not because of what it is trying to accomplish, but because of the manner in which it is going about it. Certainly making low-cost child care available to more parents is an issue that deserves to be addressed. However, there are aspects of this bill that are quite frankly shocking, with one of the most being safety issues in HOA condo complexes that seem to have not even been contemplated when the bill was written. These have been outlined by others testifying today and in written comments on Nellis. Another troubling issue is how the bill mandates HOA boards and owners to allow child care businesses within condo units and then transfers all the liability to the association and its members should anything happen during the operation of the child care business. Condominiums are not designed for child care businesses, and particularly not in mid and high-rise buildings. In fact, most condo HOAs do not allow any business to operate on property. Allowing child care businesses in condos will, at the very least, cause the association higher insurance premiums, and as a result, higher costs to its members. At worst, major commercial insurance carriers could refuse to cover condo HOAs that have child care businesses in their units. There are design aspects to such condo buildings that when children are in common areas outside the child care condo, bad things can happen. If something bad should happen under these circumstances, the HOA is going to be sued by the parents, potentially causing severe financial losses to the HOA and its members. My HOA community was not built with children in mind. However, everyone needs to remember an HOA a number of years back where a 13-year-old child was injured on a swing set. A Nevada jury awarded the plaintiff $20 million. Such awards can bankrupt HOA members. AB 185 creates this liability for owners who purchase their condo unit, never expecting that one day they could be liable because a child care facility was mandated by their government to operate in a condo unit at their HOA. There is a fairness issue.
Sir, if you can please complete your remarks.
To exclude. I got about 30 more seconds.
No,
Okay.
unfortunately, if you want to send your comments to the secretary, we need to move on. So if you can just complete
Okay,
it.
well, I'll continue I'll finish my comments then in the public forum. Thank you.
Unfortunately, sir, that's against committee rules, and so you wouldn't be able to do so. But if you're more than encouraged to send your comments in written to our committee secretary, and we can get them uploaded for you. Thank you.
Thank you.
Let's move on to the next one, please.
Just a second. My name is Heather Scherloski, Scherloski. I'm going to read mine very quickly. I own and reside in a condo, and I strongly oppose AB 185 due to liability concerns and safety concerns for the children. A distinction needs to be made between condominiums and single-family homes, both of which are found in common interest communities. There are mid-rise and high-rise condominium HOAs. Children would be walking through the condo complex to get to the unit of the child care operator. This is much different and much riskier than being dropped off in the driveway of a house and then entering. That is a very important distinction. In our condo HOA, there are many dogs. Despite many of these being oversized dogs, they are still allowed. Some are service dogs or emotional support dogs. Recently, to no avail, myself and other residents raised concerns about a Rottweiler. A number of women residents have pit bulls that they cannot control. Think about a child walking down a 5-foot wide hallway and encountering one of these dogs. Think about a child and a dog turning a corner in a hallway and startling each other, or when the elevator doors open. I would hate for these situations to happen to a child. It could end in tragedy. I contacted Assemblymember Anderson and asked whether children would be allowed to use the swimming pool, barbecue area, etc. She mentioned the gym. All these pose very serious safety concerns. Our HOA does not have a lifeguard. We have gyms, and gyms can be dangerous places for children, even if supervised. Over the last 5 years at our condo HOA, we have had many serious criminal events. I don't think this is just a situation for our HOA. I have a number of them listed. My comments are posted in the exhibit, so I'm just going to quickly identify a few of them so you can appreciate why children in condos.
Ma'am,
excuse me.
Unfortunately, you've reached your time limit, so if you can just complete your remarks.
Okay, I will complete by saying, under current law, an operator is to control and make safe the environment their child care facility is in. When you have child care in a single-family house, the operator can control the environment the children are in. If child care is allowed in a condo unit,
thank you so much for your comments. If you want to send them in writing to our committee secretary, we'll greatly appreciate it. Thank you so much.
Yeah. I would just like to mention that
Yes,
I
ma'am.
believe
Thank you.
that other presenters were allowed to speak longer. So
No,
I just
that is
want to
not the
make
case.
that
I have
comment.
2 minutes for everyone, just as I did
All
for
right.
you. Thank you. Let's go ahead and go to AVH if there's anyone online.
If you'd like to testify in support, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in support at this time.
Thank you so much. All right, now we will move on to neutral testimony. If there's anyone in neutral that would like to testify on this bill here in Carson City or in Las Vegas. AVH, is there anyone online?
Testify, please press star 9 on your phone to take your place in the queue. Chair, there are no callers at this time.
Thank you so much. Does our bill sponsor have any closing remarks? All right. Seeing that it's been waived, we're going to go ahead and close this bill hearing and move on to our next one. I am going to take it a little bit out of order just because I know our Assemblymember Brown May is here. So I'm going to do AB 484 next and then 521 last. It's her birthday. I got to do it. I'm going to go ahead and open this hearing. This bill revises provisions relating to the collection of data concerning providers of healthcare. Assemblywoman, please begin.
Thank you so much for my lovely birthday present today and calling me out of order. For the record, my name is Tracy Brown May, and I'm proud to represent Nevada Assembly District 42 in the heart of Clark County. I had the honor of sitting on the Joint Interim Committee on Health and Human Services and co-chairing the Southern Nevada Forum's Health Committee. In the course of those meetings, one of the topics that kept coming up over and over and over is staffing for our medical professionals and how we have a shortage of many medical professionals throughout our state. And then I attended an NCSL conference, National Conference of State Legislators, and we did a number of healthcare initiatives. And so probably 3 or 4 times over the course of the interim, I've traveled to participate in NCSL healthcare conferences, and staffing for medical professionals is an issue that's raised across the country. One of the solutions proposed is the collection of data of medical professionals in a consolidated database where we can then identify as a state where we have shortages in medical professionals. In looking at the roadmap that is presented as part of those national materials, we identified that in Nevada, we currently collect data. It is voluntary. It's managed out of the Division of Health and Human Services. And there were a couple of things that we weren't asking. So those have been added as this measure shows. So it's pretty cut and dry, the bill that you have in front of you. It adds sex of the applicant to the data that we're already collecting, which would tell me if my gynecologist is female or male. Any other jurisdiction where the applicant holds the same type of license, certificate, or registration, so I would know if you had a dual license in another state. Whether the applicant utilizes telehealth is defined in NRS. So do we have access to you as a telehealth provider? I met a nurse based out of Las Vegas and Texas who is a telehealth provider just last week. So that was really great. The types of patients who the applicant serves is included, and if they speak other languages. So how do we have accessibility? This is just the pieces that we're missing from the national roadmap that's being collected consistently across the country that we can add into our database collection system. This is the first step then to how do we collect the data consistently. So right now it's about collecting all of the data that's necessary so that we can continue to pursue additional federal dollars to help us with medical staffing. And so that's what this measure is in its entirety. I'm happy to stand for questions.
Thank you so much. Committee members, do we have any questions? Senator Titus.
Thank you, Mr. Chair. Did you say, just for clarification, if I might, first and foremost, happy birthday. That's the most important thing to say to you, that you want the registry to have whether they're male or female?
Tracy Brown Ray, for the record, that is correct. You can elect to not answer that, but it is the recommendation in the national standard that a person would identify what sex they are.
So you're just asking them to identify what sex they are, because it's been clear in this building that assembly members, you took word man or woman away from that, but now that you want the healthcare provider to identify as a male or female. Is that correct?
Tracy Brown May, for the record. Senator, that is correct. That is the national standard and the roadmap that is identified in the data collection so that you can choose the type of physician that you want to access. So it's really data collection. It would be up to the applicant whether or not they disclose that. I don't know that that's relative to assembly member, as that's written in our Constitution from what I understand, and why we chose as a body to move in that direction. So I don't want to go there because it's not relative, I don't feel, to this conversation, and it is voluntary disclosure, correct?
Right, that's where I'm going then. So if they don't have to answer that, they can have none of the above or NA, or they won't be forced to answer that question.
Tracy Brown May, for the record, that is correct, Senator. We would not mandate that any specific answer that is not comfortable for the person that is filling out the survey. We want the question to be asked, Senator, to be clear, and for people who are not comfortable in answering the question, for them to have that option also.
And is it listed as what sex you are versus how do you identify, what sex you identify as?
Currently, the way that this is written is sex of the applicant. Tracy Brown May, for the record. Sex of the applicant is what will be written into NRS.
Okay. That's all my questions. Thank you, Chair.
Thank you. Any other questions? Vice Chair Taylor.
Thank you, Chair, and thank you, Assembly Member and Chair to HHS on the other side. Just quickly, what are we hoping to do with this data? Why is this important to do?
Tracy Brown May, for the record. Thank you, Senator Taylor, for that question. We're hoping to actually be able to access additional federal grant dollars by having consistency in the data that we're collecting upon licensure renewal. That's the goal.
Any other questions? Let's move to testimony. If you're in support of this bill, please come forward. I don't see anyone here in Las Vegas. AVH, is there anyone online?
To testify in support on AB 484, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in support at this time.
Thank you. Let's move to opposition. Is there anyone in opposition? I don't see anyone here or in Las Vegas. AVH, is there anyone online?
To testify in opposition, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you so much. And let's move on to neutral. Is there anyone in neutral? Seeing none. AVH, is there anyone online?
To testify in neutral, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you so much. Assemblywoman, do you have any closing remarks? Have a very happy birthday. And we're going to go ahead and close this bill hearing and move on to our last one, which is AB 521. I'll invite back Assemblywoman Anderson to present. This bill revises provisions relating to the protection of children, so you may begin.
Good evening again. Assemblymember Anderson here for Assembly Bill 521. I'd just like to again thank Chair Donate, Vice Chair Taylor, who's here this time at the beginning, not to mention that she wasn't last time. I'll just make fun of her later about that. And the Senate Health and Human Services Committee. I still represent Assembly District 30, and it's still my honor to be able to present AB 521. This bill was inspired by a series of audit reports from the legislative auditor regarding governmental and private facilities for children. And I believe there was another individual that sat on this committee when we heard about it, or sat on the audit committee when it was presented in January of this year. Maybe it was December of this year. I think it was January, though. The first audit report, just a little bit of background information. The first audit report is from January of 2024, which included a recommendation to require healthcare support from December of 2024, repeated this recommendation. Currently, healthcare facilities licensed by the Bureau of Healthcare Quality and Compliance, HCQC, are not required to screen employees who have direct contact with children for substantiations of child abuse or neglect. Specifically, these facilities are not required to submit employees' names to the statewide central registry for the collection of information concerning the abuse or neglect of a child prior to an employee's hire. A submission to this registry is called a Child Abuse and Neglect Screening, or CANS. While some facilities voluntarily perform these screenings, 9 of the 15 facilities inspected in 2023 did not screen their employees. Let me say that point again. 9 of 15. Having no requirement to perform these screenings introduces the potential for people who are known to have neglected or abused children, who prey upon children, to work in an environment with direct contact with these same individuals. From the January 2024 report of the legislative audit, the governmental facilities considered include any facility owned or operated by a governmental entity that has physical custody of children pursuant to the order of a court. That's found on page 2. The bill's summary, the bill directly addresses the issues raised in the audit report by requiring facilities licensed by HCQC to perform initial and periodic child abuse and neglect screenings of all employees. This process requires the facility to submit an employee's name to the statewide central registry to determine if there has been a substantiated report of child abuse or neglect against the individual. Additionally, the bill requires an intermediary or transitional, I can't say the other word, a service organization to terminate the employment of any employee who provides services to a person with a disability or child if said employee has a confirmed report of abuse or neglect of a child against them. I'm trying very hard to be very analytical and to get to the point about this bill and to not allow my emotions to come into it. But quite frankly, as many of you know that serve on this committee or have had the opportunity to work with before, you know it's very difficult for me to simply look into language and to not start seeing my students or other individuals who I know have been hurt and who I've been able to help. The emotions of anger and disgust, even looking at this. And even thinking about the report that I believe I sat next to Senator Titus, she was aware of how upset I was when this report was first presented to us. This disgust that I have for these predators, I know is shared by most of us, if not all of us in this building. These attackers prey upon our vulnerable kids Individuals who already are questioning themselves because they are not in a home or facility where they feel loved. Many times they are put into these facilities because of situations that are not in their control. We need to make sure that they are being safe and held in the respect and regard that they should be. This is just too important for us just to sweep under the rug and think that, well, 80% of those items that are licensed is enough. It should be 100%. Our students, our children, and our society deserves that. I believe AB 521 would enhance the protection of our children in these facilities. I thank you. I will do my best to answer any questions of the committee. And before doing so, though, I do want to thank the legislative auditors. In particular, Haley Cornelia Swift, Monica Seifer, Jennifer Otto, and Todd Peterson, who performed the audits. They looked at the words that we create as a law, and they made sure that they were being followed in practice. They went to the facilities. We simply help to enact laws. They make sure that they're actually being followed. If we are successful in getting AB 521 to be passed, it is because of their work. Thank you very much, and I'm ready for any questions.
Thank you so much. We have a few questions. Senator Lane.
Okay, I have the hiccups, so if I hiccup. I really like this bill a lot, and having been in this situation personally before, I think it is so important, and thank you for bringing it forward.
Thank you, Senator Lane. Any other questions? No? All right, let's go ahead and open it up for testimony in support of the bill. If you would like to support this bill, please come forward.
Hello, Chair Doñate and members of the committee. My name is Carissa Pierce, Carissa Pearce, and I am with Children's Advocacy Alliance. We are in very strong support of AB 521. I think it's very clear that it's a necessary bill. It prioritizes the safety and well-being of vulnerable children, which is a very necessary proactive measure to help prevent potential harm to children. People with a history of abuse of children should never be in a position or employment where they can interact or care for vulnerable children. This is an incredibly necessary step in ensuring that harmful adults are not given the opportunity to harm in our care facilities that are meant to be safe spaces and are looked at as safe spaces. We are responsible for protecting our youth, which starts with who we let take care of them. So we would thank the Assemblymember Anderson for presenting this bill and for all of you for considering and closing this harmful loophole. Thank you.
Good evening, Denise Tanada with the Children's Cabinet. It's late, and I'm just going to say we are in very strong support of AB 521. Thank you.
Thank you so much. Anyone else? I don't see anyone here in Las Vegas. AVH, is there anyone online?
If you'd like to testify in support, please press star 9 on your phone to take your place in the queue.
Good evening, Chair and members of the committee. Again, for the record, my name is Riley Svensson, spelled RYLEY-SVENDSEN, and I am the policy specialist with the Nevada Coalition to End Domestic and Sexual Violence. We are here today in strong support of AB 521 as it represents a critical safeguard for children. Ensuring that facilities and organizations that provide services to children are safe, we can ensure that children have the best chance to heal and thrive, ending cycles of trauma. And we urge you to support this bill. Thank you.
Chair, there are no more callers in support at this time.
Thank you so much. If there's any opposition, please come forward. I don't see anyone here in Las Vegas. AVH, is there anyone online?
Chair, there are no callers in opposition at this time.
Thank you so much. Let's move on to neutral. Anyone in neutral? I don't see anyone here in Las Vegas. AVH, is there anyone online?
Chair, there are no callers in neutral at this time.
Thank you so much, Assemblywoman. She's waiving her remarks, and so we'll close the bill hearing, which brings us to our last agenda item, which is public comment. Oh, give me 1 second. We're going to go into a quick 1-minute recess. All right, we're back from recess. It sounds like we've had some internal discussion, and we have a motion from remarks from Senator Titus. Senator Titus.
Yeah, thank you, Mr. Chair. I feel very strongly that this provision relating to the protection of children, AB 521, has total complete support in the Assembly. No opposition, no amendments, and I feel that I'd love to move it for work session.
Thank you. So we have a motion to do pass.
Do pass.
And a second from our vice chair. Do we have any discussion? All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will assign that floor statement to Senator Titus.
Thank you.
And that concludes that agenda item, and we are now at our last one, which is public comment. So if anyone would like to provide public comment at this time, please come forward. I don't see anyone here in Las Vegas. AVH, is there anyone online?
If you'd like to participate in public comment, please press star 9 on your phone to take your place in the queue. Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much. That concludes the agenda items for today. We have a busy day on Tuesday, and we look forward to seeing everyone there. Meeting is adjourned.